Hi there, this is Mrs. Rusnak. Today I'm going to teach you the skill PPE and feeding a dependent resident. First of all, PPE stands for Personal Protective Equipment. And this skill requires you to don a gown, a face shield or goggles, and gloves. All right? So the first thing I'm going to do is I'm going to go ahead and use hand sanitizer. I'm going to rub that into all surfaces and make sure it's dry. And then I'm going to go ahead and I am going to put my PPE on, okay? So the first thing you're going to do is you're going to put on a gown. This can either be a paper gown or a cloth gown. Obviously, if it's a cloth gown, it's going to be laundered and it's going to go in the laundry basket when you're done. And if it is a paper gown, it's going to go in the trash can. So I'm going to go ahead and put my gown on. I'm going to make sure that I tie my gown around my neck and my waist. You want to make sure that your back is covered. All right, so we're going to do both of those. And I would suggest tying them into bows if you can. That way you can get them out. And you may have to get a little bit of assistance from someone and get the back tied, but I think I can reach this one myself. All right, the next thing I'm going to do is I'm going to go ahead and don either a face shield, okay? Take my glasses off. Looks like this, okay? Or I can go ahead and put goggles on instead. I'm going to start with goggles. I may have to switch if they get foggy. And this was actually a little bit too small, so I'm going to make this a little bit bigger. And I'm already starting to fog up, so I'm going to go ahead and put the face shield on. Okay, next thing I'm going to do is I'm going to go ahead and put gloves on. Now, it is important that there is no space and you're not showing any skin between your gloves and the gown. And I'm going to go ahead and take, since I have my face shield on, I'm going to go ahead and remove my mask underneath this. That way I can breathe a little bit. All right, so I'm going to make sure my gloves are on, make sure I have no skin showing, and pull these gloves over top of the gown. All right, the next thing I'm going to do is I'm going to go ahead and I'm going to go in and introduce myself to the patient, but I'm going to make sure that I have all my supplies ready to go. All right, I'm going to make sure that I have a clothing protector. Okay, we do not want to call this a bib. We want to make sure that we do call it a clothing protector. You can also use a napkin or a towel on their gown or their clothing to protect them from getting food there. I also want to go ahead and have a wash rag ready and a towel to wash and dry their hands. I have 2 wash rags ready. I have their tray ready to go, and I'm kind of all set up now. All right, I'm going to go ahead and knock on the door. Knock, knock. Hi, Mrs. Buttercup, how are you?
Good.
I'm going to introduce myself. My name is Amy. I'm your STNA, and then I'm going to explain what I'm going to do. Are you ready to eat?
Yeah.
Are you hungry? All right, we're going to go ahead and get you set up, and we're going to feed you, okay? All right, the next thing I want to do is I want to get her tray ready. All right, and I'm going to go ahead and I want to sit her up at 45-degree angle because no one likes to eat laying down. That's not a natural position. All right, we're going to sit her up at least 45-degree angle. If she feels more comfortable sitting even further up, you know, 60-degree angle, 90-degree angle, you can do that also. But they're telling you in the directions at least 45 degrees. So think about 90 degrees being like a wall and a floor, okay? So you want to go kind of in the middle to be at 45, okay? So that's about 45 degrees. I'm going to go next and put on her clothing protector. Go ahead. All right. And the next thing I'm going to do is I'm going to go ahead and wash her hands. So I'm going to run over to the sink and get this wet. Now, the skill does not tell you to get a wash basin, soap, anything like that. So I'm going to go ahead and just get 2 washcloths damp. That way I have a washcloth for before she eats and a washcloth for after. All right, and then I'm gonna go ahead and wash the resident's hands. Let's go ahead and wash your hands, Mrs. Buttercup, okay? Now, if she can do it herself, can you wash your own hands, Mrs. Buttercup?
Yeah.
So we can have the patient or the resident wash their own hands if they can. We want to, encourage independence as much as possible. If she can't, I'll do it for her. So we'll set this here. This dirty washcloth she just washed her hands with goes in the linen hamper. I'm then going to go ahead and dry her hands or have her dry her hands. Okay? And then this goes into the linen hamper. All right, the next thing I'm going to do is I'm going to get her tray of food. Now, I would want to get this at the last minute so everything is warm. A lot of facilities will have covers, like metal covers that go over these to keep them warm longer. A lot of facilities, if they are passing trays in the hall, they will have like a metal kind of shelving, enclosed piece of equipment that keeps all the food warm, all right? So what I want to do is when I get her tray, I want to make sure that she is the patient that I'm talking to, that I think I'm talking to, Mrs. Buttercup. And I want to make sure, I don't know if I said that at the beginning, I wanted to identify that this was Mrs. Buttercup. But now I especially want to make sure that Mrs. Buttercup's tray matches her tag or her bracelet, that it is the person that you're supposed to be feeding. I also want to notice what type of diet that they are giving her, because I want to make sure that I'm giving her the right diet. In other words, if a resident is on a low sodium diet, I want to scan the tray and make sure that there's not anything like packets of salt or anything that's super salty on the tray. If they're diabetic, I want to make sure that there's nothing that has obvious sugar in it, okay? Now, this says that she's on a soft diet. This is for Mrs. Buttercup, and it's saying that she is allowed to eat chicken noodle soup, Jell-O pudding, have drink, and crackers, and that is what matches on the tray. So I first want to make sure that that is correct. All right? The next thing I'm going to do is I'm going to go ahead and I'm going to put the tray in front of her, and I'm going to describe the food to her. I'm going to move this so that this can come up towards her. Okay, and then what's really important about feeding a person is that you want to be at eye level. So you could grab a chair. You would not sit on their bed, okay? But you could grab a chair and then be at their level. And you're going to want to feed her. You're going to describe the food. You can use the clock as a description. All right, I see here that we have chicken noodle soup, we have crackers, we have chocolate pudding, and we have some Hawaiian fruit punch. Okay, Mrs. Buttercup? What do we want to start at?
Soup.
Soup? Okay, so if they are visually impaired, you can describe it like a clock. You could say that the soup is at about 3 o'clock. The Hawaiian fruit punch is at 12 o'clock. The crackers are at about at the 9, okay, at the numbers of the clock is kind of how you could describe it. All right, we're going to start with soup. We'll go ahead and take a little scoop. All right, oh, and we can't do this without her mask, so we're going to ask her to remove her mask. And I'm not sure at your facility if the residents will have a mask on or not, but if they do, you'll just ask them to remove their mask. Obviously can't eat with the mask on. All right, and then we're going to go ahead and start with the soup. And you're going to give her small bites, and you're going to give her time in between bites to chew and swallow her food. You don't want to rush the resident and that type of thing. All right. So you're going to offer all the different types of food, and you're going to also wipe her mouth, especially with things like soup and stuff like that. You're going to wipe her mouth. If she can wipe her own mouth, you're going to encourage that, but we're going to act like this resident is a dependent resident. So in other words, she can't do anything for herself. So I want to at least wipe her mouth twice, more if it needs it, and then I'm going to offer her other types of food. Would you like a cracker,
Sure.
Mrs. Buttercup? Okay. There you go. Bite. All right. And the other thing you want to do is you want to offer her a drink at least 2 times. Would you like something to drink? And again, I don't want to rush her, so I'm going to wait until she's done, and then she can talk to me.
Yeah.
Okay. And I'm going to wipe her mouth again. All right. You want some chocolate pudding?
Yeah.
All right, so we're gonna open this up for her. Now, you will also notice, I'll wipe this off, you will also notice on this tray, there's kind of like a sticky mat. And these are nice, not every facility has them, but it helps from the dishes sliding around and that type of thing. So you might want to put that underneath the tray, although the kitchen will get most of this stuff ready. All right, one other bite. All right, what else do you want, Mrs. Buttercup?
Another cracker.
Another cracker? Okay, I'm gonna wipe this off in case she wants soup. I don't want to mix like the ingredients on the spoon and that type of thing. Okay, would you like something to drink? All right, so again, we're gonna wipe her mouth at least twice and we're gonna offer drink at least twice. All right, do you want anything else, Mrs. Buttercup? You're full? Okay, so the next thing I'm gonna do is once she is done eating, I'm gonna go ahead and get up and take her tray away. Push that back there. And I'm gonna make a mental note here. I wanna know how much food she ate. It needs to be within 25% accuracy. So if she ate all of her food, all of her solid food, that would be 100%. If she ate about half of her meal, that'd be 50%. And then when the state tester checks your numbers, you need to be within 25% accuracy, all right? As far as the liquids go, the liquids, you need to be within 60 milliliters of accuracy, all right? So if she drank, let's say 100 milliliters of liquid, and I said 150, I would be within the accuracy range. As long as I don't say 170 or 180, then I am more than 60 milliliters off. All right, just on a side note, the containers or the cups that you will use, all right, they are standard size. This container is 240 milliliters. This container is 120 milliliters. You need to memorize that and know that. 240 milliliters, 120 milliliters. And just on a side note, you want to take the measurement from what is empty in the glass, okay? Not what is left in the glass. And a lot of kids make this mistake. I'm gonna take this out for demonstration purposes and show you. All right, so this is a 240 milliliter glass. If she had drank half of this, say that when I brought this to her, the fruit punch was up to this level, and now it's at the level it is, I would say that she drank approximately half of this. I'm looking at the empty space as to what she drank. So I would then write on my card that she drank 120 milliliters, all right? Let's go to the 120 glass. So let's pretend like I bring her a glass that is filled this full. Okay, this is 120 milliliters of fluid. Let's say that when she's done eating, this is how much is left in the glass, okay? I am taking this measurement of the empty space, and this is about 20 milliliters of liquid that she ingested. So I put 20 milliliters now down. Don't make the mistake and put this amount of liquid down. We've had kids do that. Okay, so that's just as far as the standard cups that you're gonna use. I'm gonna put these back here. Okay, the next thing I'm gonna do is just take a mental note. She did not eat very much. So I would say she ate about 25% of her meal, okay? And I would say as far as her drink, she drank about probably 20 milliliters of liquid. Okay, so I'm gonna just remember that in my head. I'm gonna take her tray away. I'm gonna dispose of it in the appropriate area, wherever that is for my facility, either back on that metal kind of cart or back to the kitchen or whatever is set up, all right? The next thing I'm gonna do is I'm gonna go ahead and take the wet washcloth. I'm gonna take her tray away. If this needs wiped off, if there's any mess on it, I would do that. I'm gonna go ahead and remove her clothing protector. This goes in the linen hamper, okay? I'm also going to make sure that she remains seated in her bed at 30 degrees. So I can go ahead and lower her a little bit. She needs to stay at 30 degrees for 30 minutes. That's just so that her food continues to work its way down, she's able to digest well, she doesn't get any type of acid reflux and that type of thing. All right, we can go ahead and put your mask back on if you want. All right, the next thing I'm gonna do is I'm just gonna wash her hands, make sure she's cleaned. And I'm gonna grab another towel. I'm gonna throw this in the hamper. And I'm gonna grab another towel to dry her hands. Okay. Throw this in the hamper. Okay, the next thing I'm gonna do is I'm gonna go ahead and make sure she has her call light. Her bed should already be down at the normal level. You can check it to make sure, but it should be down at the normal level because you're seated with her, feeding her. And then you're gonna ask her, is there anything else I can get for you, Mrs. Buttercup? Okay, if you need us, you just give us a call, okay? All right, and then I'm gonna go ahead and kind of walk out of the room. Then I need to take my PPE off, okay? You're kind of do it in the opposite order, but the first thing you wanna do is remove your gloves. And you're gonna remove that in the correct way where you handle these in your glove and then wrap the other glove around it. And then this goes into the trash can. So into the correct disposal. The next thing I'm gonna do is I'm gonna go ahead and take my face shield off. I'm gonna put this back on. All right, and then the next thing I'm gonna do is undo my robe or my gown. Now this one's a fabric one, so this is gonna go in the laundry hamper. I'm having a little trouble. You wanna help me, Liz? Oh, I got it. I think I got it. And like if these are paper, you can just rip them off. They're nice. Now, you're not just gonna fling this off and take it off. You're going to go ahead and try to turn it inside out and only touch the inside because the inside is clean. And kind of roll it on top of itself. Okay, hold this away from your uniform and you're gonna dispose of it in the linen hamper. All right, the next thing I'm gonna do is I'm gonna go ahead and use sanitizer. These face masks and these shields, they may have to go in a specific container and be cleaned in a certain way according to your facility. So you would wanna make sure that you would put these away wherever they belong. The last thing I wanna do is I wanna go ahead and take my little piece of paper and I wanna go ahead, can you answer that? I wanna go ahead and write the resident's name. And then on this is the food, okay? So I wanna put how much she drank. I'm gonna write 20 milliliters. And I wanna put the percentage of food she ate, which is 25%. And then I wanna go ahead and sign my name, okay? And then this would be documented or reported to the nurse, or there might be a book that you enter this information into. All right? One of the things I might have forgotten, if you're in the residence room and they want, you probably should pull the privacy drape at the beginning and then you would close it at the end because some people would get embarrassed if they're dribbling food down their mouth and that type of thing, or if they had a roommate or that type of thing. So make sure that you do pull the privacy drape at the beginning and then open it at the end. All right? And I think that's it. All right? Thank you very much.